surface, that smooth marble-like surface, in the first stage of arthritis, in fact you wouldn't even call it arthritis at this stage, it starts to get soft. And when the surgeon goes in and he puts his probe and presses on the surface, it kind of dents in slightly. And that would be the first stages of it starting to deteriorate. As it gets worse, it starts to sort of lift up, and it's like grass, basically, long grass kind of floating around in the joint. And then as it gets worse, the grass gets longer effectively, and you get bits breaking off and loose bodies in the joint. And once it gets down right the way through, that's arthritis. When it's gone right the way through the hyaline cartilage, so down to the bone, that's what arthritis is. Once you get through to that, once you form a little hole, that hole will just get bigger and bigger and bigger over time, and the bone underneath now starts to wear down. And this is when it's starting to get painful, because the hyaline cartilage, that lining cartilage, there's no pain nerves in there. But once you get to the bone, you're starting to stimulate pain nerves, and that's when you start to get pain. Because the joint is now getting pressure on the bone tries to reinforce itself, to strengthen itself. And that's when you get bony spurs. Okay, you can see them labelled on there. And they then start to cause problems in themselves. They start to impinge on tendons and impinge on muscle and cause problems of their own. So although the body is trying to heal itself, it's actually causing the problem to get worse. And if you can imagine the picture on the right there, as the joint starts to collapse as well, it will start to bow. Right, so it's usually the inside part of the joint that goes, and that's where you start to get your bow-legged appearance. You know that you're getting quite advanced arthritis at that stage. So often when people have the surgery, they'll come out with the leg will be straightened if you're waiting for surgery. Hips are different. Presumably you're waiting for a hip. You don't bow like that in a hip, but you certainly do on a knee. I'm assuming it's a knee.
No, hip.
Hip, okay. Well, I don't know why I thought it was a okay. And any questions on that slide? No? The next one, hip. As we're talking about a hip, as we should talk about the hip. With two people with bad hips. So, in the hip joint, so the hip on the right there, or left, basically it's a ball and a cup, and the ball basically starts to wear its way into the cup and grind its way into the cup. And in very, very severe cases it can actually bore its way right the way through, which is pretty severe, but most people aren't that bad. It just starts to wear its way down. And you get bony spurs around the edge of the cup, and that now is starting to really restrict the movement. So an arthritic hip is quite stiff, lacks rotation, lacks abduction. Okay. And you can also see on there where the bone, I mentioned earlier about how the bone, here the bone is nice and sort of clear, here it's kind of more white, and what it's doing is the bone is trying to reinforce itself. It's trying to strengthen itself.
For me, the top half isn't so bad. It's at the bottom of the ball that is sort of disintegrating.
So
apparently, down below, down there, yeah.
This edge here.
Yeah.
Same as me.
Down the bottom edge, yeah.
Yeah, I mean obviously it's a big joint, so different parts will wear. It's one spot edge. Yeah.